Welcome to Diagnosis U. Today we will be discussing hairy cell leukemia. Hairy cell leukemia. Symptoms, treatment, and recovery. What you need to know. You may be asking yourself, what is hairy cell leukemia? Hairy cell leukemia, or HCL, is a rare and slow-growing type of blood cancer. Though it sounds intimidating, it's treatable. And many people live long, healthy lives after diagnosis. Let's walk through how to recognize early signs, get the right treatment, and ask the right questions. HCL affects your B cells, a type of white blood cell made in the bone marrow. These abnormal cells look hairy under a microscope, hence the name, and they crowd out healthy blood cells, leading to serious health problems over time. Here's a look at HCL. Early detection and symptoms. Early symptoms can be subtle or mistaken for other conditions, which is why awareness is key. Here's what to look out for. Persistent fatigue, frequent infections, easy bruising or bleeding, unexplained weight loss, fullness or discomfort in the upper left abdomen from an enlarged spleen, low blood counts found in routine tests, anemia, low white cells, low platelets. If you've had these symptoms for more than a few weeks, especially along with abnormal blood work, it's time to talk to a doctor. To confirm HCL, doctors may use blood tests, bone marrow biopsy, flow cytometry, a test to identify cancerous cells. You'll want to see a hematologist, oncologist, a specialist in blood cancers. The good news? HCL is highly treatable. Many patients go into remission for years after therapy. Treatments include cladribine, 2-CDA, a chemotherapy drug given over a week, often the first-line treatment, pentostatin, another chemo option, rituximab, a monoclonal antibody sometimes used if the leukemia returns, splenectomy, removal of the spleen. Rare, but considered if the spleen becomes too enlarged. Clinical trials for resistant cases. Most patients respond well to a single round of treatment and don't need therapy again for several years. After treatment, your immune system may be weakened. Here are some dietary tips to support recovery. Focus on high-protein, nutrient-rich foods like lean meats, legumes, and eggs. Eat plenty of fruits and vegetables for vitamins and antioxidants. Avoid raw or undercooked meats, unpasteurized dairy, and unwashed produce to prevent infection. Stay hydrated and limit processed sugars. Recovery timeline. Most people regain energy and healthy blood counts within 3 to 6 months. Your doctor will monitor blood work during this period to track remission. Key questions to ask your doctor. If you've been diagnosed or think you might be at risk, ask your healthcare provider. What type of leukemia do I have exactly? What's the best first treatment for my case? What are the chances of remission and relapse? How will treatment affect my immune system and daily life? Are there any side effects I should be aware of? Should I consider a second opinion or a clinical trial? Hairy cell leukemia may be rare, but it's manageable with the right care. Knowing the symptoms, working with a specialist, and asking informed questions are your first steps to healing. Like this video if you found it helpful, and subscribe for more health insights. Have questions or personal experiences with HCL? Drop them in the comments. We're here to support each other. Until next time. Stay informed, stay proactive, and most of all, stay healthy.